Welcome back to the morning show here on Arise News with me, Keturah King. The doctors at the aesthetic clinic can tackle almost any dermatological procedure. Dr. Ifeoma Abajue is a medical doctor with 12 years' experience of providing advice on proper skincare with customized services and products. She holds a diploma in dermatology from the prestigious University of Wales in Cardiff and from the American Board of Aesthetic Medicine, where she distinguished herself in the aesthetic sector. Now she runs a successful skin clinic where she consults and offers treatments. She's also currently the principal of the Beauty Therapy Institute in Lagos, which is part of the South African franchise. Both her and Dr. Samuel offer consultations, treatments, and the highest standard of education and training in the health, beauty, and skincare industries. With a wide offering of over 40 basic and advanced courses and internationally recognized certifications. And they're here to answer your questions. Good morning, guys. How are you?
Good morning.
Great.
Thank you so much for joining me on our Ask a Doctor segment. So we're talking skin today. Now, tell me a little bit about your clinic, the aesthetic clinic. Who's going to start?
Okay, so I would start
Yes.
because I'm not a doctor. I am a licensed medical esthetician. So I start the clinic, I work at the clinic. So she's my supervising doctor. Okay, so the aesthetic clinic is actually one of the foremost clinics in Lagos, Nigeria, providing top-notch non-surgical skin rejuvenation procedures that are highly customized to our different clients. So we are able to help you get any beauty goal of yours.
Really?
Yeah,
So if I walked into your clinic and I had acne all over my face and I wanted to get rid of it, you'd be able to do that?
Acne is the least of the problems we tackle.
What? Is it a magic clinic? I don't understand. Is it magic that takes place there? How does this all happen?
Okay,
so
now,
walk me through some of the different types of skin conditions that you can treat.
Okay, now, like you said, acne is a big issue because we have many people coming in with acne so many times. Now, the thing about acne is there are 4 scientific causes of acne. Now, I hear people saying that there are so many causes of acne, there are so many causes of acne. No, those other causes are actually factors that are not scientific, but there are 4 main scientific causes of acne.
Okay.
And so because we have mastered these 4 scientific causes of acne, we try to look at these 4 causes and then we are able to tackle acne
I love
the
this.
right
Okay,
way.
educate us. So what's the number 1 cause?
Okay, so the number 1 cause of acne is the rate and amount of sebum production.
Okay.
So the skin produces something known as sebum. Now, sebum is just oil, basically oil. So
Oil in the skin.
yeah,
Okay.
yeah. So it lubricates the skin.
Right.
So if excessive sebum is produced, okay, there are chances that the skin pores can get clogged.
Right.
And then we know that every day the skin turns itself over. Now, the top layer of the skin is dry, dead, and non-nucleated. And the skin is covered with what we call comedones. We have open and closed comedones.
Gosh, I feel like I'm in school. Yes, okay, teach me more.
Okay,
open and closed comedones.
so when the sebum traps in the dead skin, in a pore, a comedone can get inflamed.
Right, and that's what we regard as acne.
Yeah.
Right.
So when the inflammation keeps going up and up and up and up, it keeps going on. So that leads us to the second cause of acne, inflammation.
Right, okay.
Yeah, inflammation. So that's the second cause of acne. Now, the third scientific cause of acne is what we call the P. acnes, the Propionibacterium.
What does that mean?
So it's a bacteria that's on the skin.
Right.
So it causes acne. Okay, it's part of the scientific causes of acne.
So does everyone have this bacteria on the skin?
Yes.
Everyone has it.
Then how come everyone doesn't have acne?
Okay, everybody doesn't have acne because if your skin is compromised and the bacteria gets to work and then causes inflammation.
Right.
That's how it works.
So, it is a bacteria that exists naturally on the skin. So I have it on my skin right now.
You definitely have it.
But because my skin isn't inflamed, which is why I don't have acne. I see. Okay. And what's the 4th cause of acne?
Okay, so let me finish up. Now, the 4th cause is the male androgen hormones.
Which means?
Okay, so the male androgen hormone is, that's why most women who are in the menstrual cycle periods often break out, because at those points in time, the male androgen hormone is produced in excess amounts. So what do? They stimulate the sebaceous glands to overproduce sebum. It still boils down to the sebum. Okay, so that's the fourth cause of acne.
Wow.
So those are the 4 scientific causes of acne.
Let me also add that androgen is produced in moments of stress.
Right.
Yeah.
So that's why
you get stress
when you get
breakouts.
stressed and then the androgen levels increase, it causes breakouts as well.
Look at
So
that.
everything is kind of like interrelated.
I see. Okay, so let's talk about some of the treatments and procedures that you offer at the clinic. Now, the first one is one that can actually tackle and help treat acne, and that's a chemical peel.
Yeah.
So I know a lot of people, including myself, get quite confused with chemical peels because it does sound slightly dangerous. It sounds as though your skin is going to be peeling and inflamed for ages. And I'm sure that only happens if you're dealing with a person, a practitioner who hasn't really been trained very well, unlike your fine cells. So walk us through what a chemical peel is and then what kind of chemical peels you offer at your clinic.
Okay, let me start by saying that the chemical peel is not a treatment for acne as in by itself. Now, acne is caused by many things that he has mentioned, so chemical peel is one of the options. Now, there are multifactorial causes of acne, both exogenous and endogenous. Endogenous meaning from the inside, and exogenous meaning from the outside.
Okay.
So in treating a patient, we have to consider all those factors. We also have to consider the patient's emotional state, cultural background. You know, there are many things to consider. Now, chemical peel is obviously an external way of treating acne. It sounds dangerous, but it's actually not dangerous because we're dealing with the top layer of the epidermis.
Okay.
Now, why we call it a chemical peel is we use acids to like remove the top layer of the epidermis. So the epidermis is already like the top layer of the skin, and then we remove that top layer of the top layer. So it's not as, you know, dangerous as it sounds. However, there are different depths, there are different kinds of chemical peels. There are what we call superficial peels, medium depth peels, and deep peels.
And before we get into chemical peels themselves, what are the uses or the benefits of getting a chemical peel so that our viewers know exactly what it can be used for?
Well, what it basically does is, like I said, it's an acid which basically like super exfoliates. Okay, so imagine using a scrub to like, you know, scrub your skin and you want to brighten your skin. A chemical peel is like a chemical scrub. It's not physical. It's a chemical agent that will like dissolve, you know. So it's like what the effect you get from using a scrub in months or in weeks, you can get it just by doing one peel. And you get that instantly.
I see.
Yes,
okay.
so that's what it actually does.
Brilliant. And then you offer some other treatments at the clinic. So you deal with eyebrows.
Oh, yes, we do.
Now, eyebrows they frame your face. We all know that women fill in their eyebrows, you know, when doing their makeup. If you haven't got your eyebrows filled in, you sort of look a bit incomplete. Now, you offer treatments for the eyebrows in particular.
Yeah,
Talk me through that.
Okay, now, I would start with, of course, we have perfect makeup artists.
Right.
You know, who could draw in your brow. Imagine having a perfect brow every day of the
How
day.
do I do that?
Now, there's something called microblading.
OMG.
So microblading is actually a procedure where we use a pen, okay, to implant pigments in a pattern form.
A pen? A real pen?
Yeah, just a microblading pen.
Is it like a tattoo?
Now, the difference between the microblading and the tattoo is the depth and the type of pigment used.
Okay.
Okay, so for the depth of the microblading, we don't go beyond the epidermis.
Okay.
So the person actually feels like a scratch.
Right.
Not as in pain.
Right.
You get that? Okay, so other than that, we use that to stroke in the pattern and we make the pattern to look perfect in such a way that we mimic the hairlines. So we're actually mimicking the hairline.
So we can see that on the screen now, and that looks really amazing.
Yeah, so you can actually get transformed from literally no hair to something looking as nice as that.
So once a person has gotten this microblading done, would they then still need to fill in their brows?
If you want to, there are people who are addicted to their brow pencils.
And how long does this last for?
So this could last you for a year. after you would need a touch-up. So, because in some people, the pigments dissipate faster than in others.
Oh, amazing.
Yeah.
Okay.
So, knowing the fact that the pigment is actually in your epidermis, okay, it's actually in your epidermis, so the pigment actually goes out over time. So it's not permanent, it's semi-permanent.
I love that. Okay, so moving on to another treatment that you offer at the clinic. This is something that effectively takes you from looking about 60 years old to about 20 years old. The removal of puffy eye bags.
Oh, yeah,
How is this even a thing? I mean, you are blowing my mind. Talk to me about this procedure.
Okay. Now, let's talk about, it's actually a non-surgical procedure. It's not surgical. Now,
None of the procedures that you offer at the clinic is surgical.
Of course. So now, the puffy eye bags are actually removed by surgery.
Really?
Yeah.
Ordinarily?
Can be removed by surgery. That's the gold standard procedure for doing that. But not everybody wants to go through the procedure. But then we can do something about it. We can camouflage it.
How do you do that?
Now, we use something called a dermal filler.
Okay.
Okay, so Dr. Mo, just tell us about the dermal filler.
Go on, doctor, take over.
Talk about the dermal filler.
Well, the dermal fillers are actually like a substance made of hyaluronic acid, which kind of like draws in water. So it's a natural product, because when you tell people, oh, why don't you put in a dermal filler? They're like, oh, I don't want to put any toxic substance inside my skin. Like, it's not toxic. It's a product that is a substance that is naturally there, but as you age, or for whatever reason, it declines. So what we're doing is like boosting what you already have, and this draws in water and makes your skin look plumper.
Wow.
And once your skin looks plumper, your problems are solved.
Amazing. Wow, okay. And then the last procedure that I want to touch on is one that really, I mean, I saw it and I was like, is this real? How is that possible? The only way I've ever thought you could have a different nose is via a nose job. But you have a non-surgical nose job. What? Tell me about this.
Okay, so the nose job is actually our signature. Yeah, it's our signature non-surgical nose job.
Look at that on screen. How have you managed to transform that person's nose?
Now, we still use what we call the dermal filler. Now, we have people coming in from Abuja, Port Harcourt, different parts of the country just to get this nose job done. And it's like,
amazing.
it's ours.
I mean, it looks, the after picture looks as though the patient has gotten their makeup contoured. I mean, it doesn't even look like the same nose as well. Are you lying to me, guys?
No.
Is this the same nose?
No, of course.
So eventually, the contour and the whatever that the makeup artist does for you, you get to wipe that off. But with this, you get to have it on your nose, so it's still the same procedure.
Right.
We use a needle to go into the skin and insert the dermal fillers in a pattern. Now, these two procedures that we do with the fillers are actually signatory. They must be done by a they are the most difficult fillers to be done, injectable procedures done, because it takes really good techniques to get a perfect nose job.
Right.
You know, the teeth.
So I can imagine that if you went to a person who wasn't licensed, you'd end up with a botched nose.
If you get it wrong, I mean, it's disastrous.
It is disastrous.
It's on your face.
Yes, and the nose is like a primal point on your face that a person sees before your eyebrows.
Very important.
And we have to point out that it's not permanent.
Yeah.
Something, yes, because, I mean, some people might think they'll do it and that's it.
Right.
Remember, it's a natural product. So it gets broken down over time
So
by your
how long
body.
would it normally last?
About a year, 9 months to a year.
6 to 9 months to a year.
Yes, but then even when after about a year, it doesn't mean that your nose will go back to how it was before. There'll still be some improvement. So over time, there's constant improvement the more you do it.
That is amazing. You know,
it's
really interesting to talk with both of you because aestheticians and aesthetics, rather, in Lagos or in Nigeria in general, it's quite new. How have you found the response and also the fact that you train people at the clinic? What has the response to the training been like?
Well, for the training, first of all, for the whole procedure thing, people, when you tell people, come and have a nose job, I mean, it's tough. There are cultural issues you have to contend with. Of course. But to tell you the truth, one of the reasons I started going into aesthetics was because a master surgeon from the US, he attended one of our dermatology meetings, and he said, you mean you have dermatologists in Nigeria? Like, I have so many clients from Nigeria coming to me in the US for these procedures.
Right.
So he went ahead to train some of us dermatologists in aesthetics.
I see.
And that's how I got into it, really. So people do it, but they don't let you know that they're doing it.
Yes.
So that's the thing.
Yeah.
So a lot more people do it than you would imagine. And then what I find is once somebody does it once or twice, they're like, okay, it's not such a big deal. It's not so bad. You know, I'm not saying everybody must do it, but I mean, if you want to help yourself, why not?
If you want to help yourself, I love it.
Why not?
And then talk to me quickly, briefly about the training that you offer at the facility.
Okay, so the training came about when I started my business and I couldn't find anybody suitable to hire because, I mean, people are just not properly trained in Nigeria. They don't take it seriously. The people who will be professionals don't see the industry as a serious industry. You know, they think, oh, this industry it's not for a professional or for somebody like me. So that's how I got into it. And what we offer is like training in basic.
We can see some of the training tutorials are taking place on screen now.
Yes. So we also offer basic training and advanced training because before you can do advanced treatments, you must know the basics. You must know your anatomy and physiology. You know, so that's how I got into it, and the training has been actually good.
I can imagine you receiving an overwhelming response.
Well,
so let's quickly get your social media handles so that people who want to be involved in the training can contact you. People who want a non-surgical nose job can contact you. People who want to take away that puffy eye bags can contact you. How do they do so, Dr. Ifeoma?
How do they do so? Okay, so we have the website.
Okay, so our website for the school, the training facility is www.beautytherapyinstitute.co.za. So that's the website for. We are actually on Instagram. You can find us on Instagram, Beauty Therapy, BTI Lagos at Instagram. Now, if you want to follow the clinic has an IG account, an Instagram account at Clinic The Aesthetic.
Clinic The Aesthetic, not The Aesthetic Clinic.
No.
Clinic The Aesthetic. Okay.
But it's spelled in English, not French, though. Okay, so there you can find a variety of what we do, and then you can follow our Insta story. We post everything we're doing in a day, how many clients we're having in a day, and you can see some of the celebrities that are coming to get our signature Go and Glow fixture.
Yes.
I didn't mention about that.
I think we'll have our next guest talk about it because she's been a recipient and her skin is golden. So, thank you very much for joining us.
Thank you so much.
We'll see you later on the show to discuss acne in Africa.
Great, thank you.
That's all from the doctors for now, as it's time for a short break on the morning show. But when we return, I'll be speaking with a dermatological brand ambassador who spins discs on the turntable in her free time. Don't go away.